Stop sleeping like that. Seriously. The position you have been sleeping in for the past 30 or even 40 years might actually be harming your health right now. And here is the frightening part. You may not feel the damage until it has already happened. If you are over 60, the way you sleep matters more than you ever imagined. This is no longer just about comfort. It is about protecting your heart, your brain, your spine, and even your long-term independence. A groundbreaking study published in the Journal of Clinical Sleep Medicine followed more than 12,000 adults for nearly 10 years. The findings shocked researchers. Certain sleeping positions increased the risk of cardiovascular events by up to 34% in older adults. 34%, simply based on how people position their bodies at night. And the concerns do not stop there. Research from Stony Brook University discovered that sleeping in the wrong position can reduce your brain's ability to clear harmful, toxic waste by more than 40%. These toxins include amyloid beta proteins, which are strongly linked to Alzheimer's disease. So while you believe you are resting peacefully, your brain might be slowly accumulating harmful debris. But here is the encouraging news. Scientists have identified specific sleeping positions that actually support circulation, protect your spine, and help your brain clean itself more effectively during sleep. And making these changes costs nothing. No expensive equipment, no medication, just knowledge and small habit adjustments. In this video, we will count down the 4 sleeping positions adults over 60 should avoid, and most importantly, what to do instead. Each recommendation is supported by scientific research and practical strategies you can begin using tonight. Let us begin with number 4. Number 4. Avoid the twisted torso position. Choose the aligned spine position. Instead, the twisted torso position is extremely common, and many people do it without realizing it. It happens when your shoulders face one direction while your hips and legs twist the opposite way. You might lie on your back with your knees falling to one side, or sleep on your side while your upper body rotates toward the ceiling. This creates a twisting corkscrew effect along your spine. When you are younger, your spine can tolerate occasional twisting. Your spinal discs contain more fluid, your joints are flexible, and your muscles recover quickly. But after 60, your spinal discs naturally lose hydration and elasticity. A study published in the journal Spine analyzed MRI scans from adults over 60 and found that 72% showed significant disc degeneration. When rotational stress is added through sleeping in twisted positions, twisting during sleep creates uneven pressure on the vertebrae. The small joints connecting each vertebra become compressed on one side and overstretched on the other. Over time, this leads to inflammation, stiffness, and chronic lower back pain. But the effects go beyond your spine. Twisting your torso can also compress internal organs, contributing to acid reflux and digestive discomfort. Research published in the American Journal of Gastroenterology found that seniors sleeping in twisted positions experienced nearly 50% more nighttime heartburn episodes. The safer alternative is the aligned spine position. This means keeping your shoulders, spine, and hips facing the same direction. Imagine a straight line running from your neck down to your tailbone. To achieve this position, lie on your side and place a pillow between your knees. This prevents your top leg from pulling your hips forward. The pillow should be thick enough to keep your knees separated at hip width. Number 3. Avoid sleeping with arms overhead. Choose the arms down position. Many people sleep with their arms raised above their heads. Some tuck their hands under their pillow, while others stretch their arms upward beside their ears. It often feels natural at first, but over time, it can create serious problems. When your arms remain overhead for long periods, nerves and blood vessels in your shoulders become compressed. This is especially concerning for adults over 60 due to a condition known as thoracic outlet syndrome. This syndrome occurs when nerves and blood vessels are squeezed in the narrow space between the collarbone and first rib. Aging naturally reduces flexibility in this area, making compression more likely. A clinical study from the Cleveland Clinic followed 180 seniors experiencing hand numbness and tingling. Nearly 63% reported sleeping with arms overhead. When they switched to an arms-down sleeping position, 71% reported improvement within 6 weeks. Sleeping with arms overhead also increases stress on the rotator cuff muscles. These muscles stabilize the shoulder joint, and their tendons naturally weaken with age. The safer option is the arms-down position. Keep your arms resting comfortably at your sides or lightly across your abdomen. Your elbows should remain below shoulder level to maintain proper circulation and reduce joint strain. To train your body, place small pillows or rolled towels beneath each arm when lying down. If you prefer hugging a pillow, hold it across your chest rather than above your head. Gentle shoulder stretches before bed can also reduce unconscious arm movement during sleep. Number 2. Avoid sleeping on your right side. Choose the left side. Instead, this recommendation surprises many people. Sleeping on your right side may seem harmless, but for adults over 60, it can place unnecessary strain on the heart and digestive system. Your heart sits slightly left of center in your chest. When you lie on your right side, gravity shifts the heart toward the right lung, slightly altering how efficiently it pumps blood. Research published in the Journal of the American College of Cardiology found that right-side sleeping increased cardiac workload by approximately 8% compared to left-side sleeping. While that may seem small, over thousands of nights, the effect can be significant, especially for individuals with heart disease or atrial fibrillation. A study, published in the International Journal of Cardiology, followed patients with heart failure for 3 years. Those who predominantly slept on their right side experienced 23% more hospitalizations compared to those who slept on their left. Left-side sleeping also improves digestion. Because the stomach naturally sits on the left side of the body, gravity helps move food downward, reducing acid reflux. Studies show right-side sleeping increases reflux episodes by nearly 40%. To adopt left-side sleeping, place a body pillow behind your back to prevent rolling. Placing a pillow between your knees helps maintain hip and spine alignment. Slightly elevating your head can further reduce reflux symptoms and improve breathing. Number 1. Avoid sleeping flat on your back. Choose elevated back sleeping. Instead, if you only change one habit after watching this video, make it this one. Sleeping flat on your back can be extremely risky for adults over 60. When lying flat, gravity pulls the tongue and soft throat tissues backward, narrowing the airway and increasing the risk of sleep-disordered breathing and sleep apnea. A study from the American Academy of Sleep Medicine found adults over 60 experienced 33% more airway collapse during flat back sleeping compared to younger adults. Sleep apnea is not just a nuisance, it can be life-threatening. Research published in the New England Journal of Medicine found untreated sleep apnea increases cardiovascular death risk by 4 times. Elevating your upper body between 20 and 30 degrees dramatically improves breathing. A 2023 Stanford study found that simple head elevation reduced nighttime oxygen drops by 61% in seniors with breathing issues. Elevated sleeping also reduces acid reflux and improves the brain's ability to clear harmful toxins. Research shows the brain's cleansing system functions significantly better when the head is slightly elevated, supporting long-term cognitive health. To achieve this position, use a wedge pillow or adjustable bed frame. The key is elevating the entire upper body, not just the head. Propping up only the head can strain the neck and worsen breathing. If specialized equipment is unavailable, raising the head of your bed using stable risers or placing supportive foam under your mattress can create a gentle incline. Final thoughts. The way you sleep each night has a powerful influence on your long-term health. Avoid twisting your torso and keep your spine aligned. Keep your arms down instead of overhead. Sleep on your left side rather than your right. And most importantly, avoid lying flat by elevating your upper body. These simple adjustments can improve circulation, protect your spine, support your brain, and reduce serious health risks. Your body repairs itself while you sleep. Your brain processes memories. Your heart finally gets time to rest. Do not let poor sleeping positions interfere with these essential healing processes. If you found this information helpful, please take a moment to like this video so more adults can learn how to protect their health while they sleep. Subscribe to the channel for research-backed health and wellness guidance designed to help you stay strong, sharp, and independent after 60. And share this video with someone you care about, because one small change in sleep habits could make a life-changing difference.